The COVID-19 pandemic was a bitter pill for Africa. Health systems pushed beyond their limits, and the agonizingly long wait for vaccines put millions of lives at risk. As COVID fades, new challenges are rising, disease outbreaks are accelerating, while foreign aid is dwindling.
When you have so many outbreaks and you have mutations of virus, you have less resources, it means the next mutation of a virus can become a pandemic. And this is why we are warning the world. Now we are talking about disease X because we have so many viruses that can become pandemic anytime. Mpox, Ebola, Marburg.
Sweeping aid cuts from the United States has been the biggest blow to life-saving health programs. But the continent is not taking it lying down.
The US doesn't owe us anything. They were just helping. And so the onus lies on us to stand on our own. We can't go crying after Trump. He told us he doesn't want us. It's very clear. He made it very clear, especially us in South Africa. He said he doesn't want us for reasons of genocides and oppressions and expropriations, which are not there. We all know that they are not there.
As part of the G20 efforts, the African Union launched a public-private sector initiative to build pharmaceutical manufacturing chains and strengthen health systems. Africa carries 25% of the global disease burden, but depends almost entirely on imported medicines, making it vulnerable in emergencies.
We need to involve the private sector to invest in some areas to make difference. We are talking about local manufacturing, we are talking about digital agenda, we are talking about supply chain management.
While positive steps have been made since COVID-19, the continent's pharmaceutical manufacturing hubs are concentrated in a few countries, including South Africa, Nigeria and Egypt, a scenario that needs to change quickly.
This triple P finds expression in an African Union 2022 Heads of State resolution, where Africa said that by 2040 it set itself a goal to procure 70% of all its medical countermeasures, which of course includes test kits, diagnostics, pharmaceuticals and vaccines, to purchase or procure 70% from Africa by 2040.
The pace of disease outbreaks in Africa threatens the stability of the entire world. But the message from political and business leaders is clear. The continent cannot continue to put its health in the hands of others. The African Centers for Disease Control has also called for decisive policy to attract investment and build greater trust between African nations, one of the biggest stumbling blocks to expand the pharmaceutical market. Scheier, CGTN, South Africa.